Thank you all for coming. Appreciate you being here for our continuing series in the Ivins City Preparedness Seminars. My name is David Williams. I run the CERT program and also chair the Ivins City Preparedness Committee, which is a group of volunteers along with some city staff from police and fire and someone from the city council, and we work on preparedness issues. And one of the things we do is try to do these probably 8 to 10 times a year. And tonight we have the pleasure of Five County Association of Governments giving us a presentation on resources available. And before we get into it, I would like to have Sharon come up and have to say a few comments. The mayor couldn't be here. He may be here later, but he is also a big supporter of this. Sharon?
Thank you, Dave. We're so proud of our CERT program and everyone that participates in it. First of all, thank you all for being here tonight. I told almost everybody on the dais up here that I had no idea what this program's about tonight, but I was told that I needed to put it on my calendar. So on my calendar it says, absolutely must go. And then when I got here, I'm looking at all the cards and everything over here, and most of it's for senior citizens, and I wonder if that's why they told me I needed to be here. There's a clue in there somewhere, I'm not sure. But thank you all for being here. I'm anxious to learn about what you offer and how you support all of our communities. And again, thank you to Dave and our CERT program, and a special thanks to Dave. I just got a document from the mayor today on an entire emergency preparedness document for the city of Ivins that you've been working diligently on for a long period of time. And so far, I think it printed 20 pages off. I haven't read it, but I will. I promise you that. I just got it a couple of hours ago. So thank you all for being here. These are valuable programs. I'm just delighted to see so many of our residents attend. And we look forward to learning and sharing with all of you and supporting however you can support us.
Thank you, Sharon. And I'd also like to recognize Bill and Mary Ingalls, who are on our CERT team and have been a part of the emergency committee for a long time. And Bill has been the driving force behind our emergency disaster hub box system located throughout the city, and has spent hours and days and months working on all the maps and things that go in there. And so I appreciate them. I also like to recognize Wayne Pennington here. He is on our CERT team, and he also volunteers for quite a few other groups in the city of Ivins, some of them that work really hard outside, and I haven't gotten involved in that yet, but we appreciate that. And a little housekeeping, there's drinking fountains and bathrooms in the lobby over here. If you have a question, please raise your hand for the panel. And I have 2 microphone runners here. I have Bill right here, and I have Randy over here. So Randy will take care of this side, Bill will take care of this side, because we do video this so that we can put it on our city website, because for those who weren't able to make it can look at the video and still get the information. So that is it, and I will turn it over to the panel and let you folks introduce yourself. Oh, here.
Thank you, Dave. So I'm Darren Bushman, Executive Director of the Five County Association of Governments. Just came, my first day was the 1st of July, so I'm new here. But the subject is near and dear to my heart because I spent 20 years in emergency medical services, and I come to you as the prior director or state director of the Bureau of EMS. So the work that you do is really important, and I have a lot of experience dealing with CERT teams across the state, so it was very pleasurable to learn who we were presenting to. I will tell you that you're probably going to be the most educated people in Washington County about what the Five County Association of Governments does when you get done, because the reality of it is one of our things that we have lacked in is educating our community on what we have available and what we do. Just to give you a little bit of information, there's about 75 staff members. We have 6 buildings operation in Iron and Washington County, and then we have some outreach facilities in Kane, Garfield, and Beaver County that we also service. We are a real bargain for your local governments. We take about $160,000 worth of contributions from your local governments, and we turn it into $14.3 million worth of money that goes into your communities in various forms. So it's probably the best bargain that government ever gets. We use that money from your local governments to match, by and large, state and federal grants, and that's the experts that you see behind me. They eat, sleep, and drink grants and grant reporting and grant writing and service provision. That's what they do all the time. So we have a whole variety of services that they'll cover and go through. I won't steal their thunder because I'm just the designated felon. They all know what they're doing. So I get the blame if it goes wrong, but at the end of the day, we have a great team. We have a very passionate team of people that are very passionate about what they do. They know what they're doing, and I think when you see all of the programs that they offer, that you'll really come to appreciate the services that are available to you through Five County. So with that, I'll turn the time over to, I guess, who's going first? Bethany.
So, first of all, there's going to be a lot of information on a lot of different programs tonight. So, if there's something that interests you, I think the majority of our pamphlets and paper information are on this table up here. So, just kind of keep that in the back of your head. So, does anyone know, how many of you are familiar with Five County? About half? Okay. What about the Area Agency on Aging? Okay, about the same. So my name is Bethany Hill, and I work for the Area Agency on Aging. So just a little bit of background about the agency. We are underneath the U.S. Department of Health and Human Services and the newly formed Administration for Community Living. And so the majority of our funds come through federal dollars, as well as state matching, state funds, state programs, and then community donations and dollars. So the majority of our funding comes through the Older Americans Act. This is just a broad, big picture overview of all of the programs that we manage and facilitate underneath and within the Five County. We're only going to go over just bits and pieces of this today because it's a lot. So the first thing that the Area Agency on Aging does is we support our senior centers. So under the Older Americans Act, there is funding provided for meals, supplemental services, exercise, and recreation. So these are just the numbers for the Five County Senior Centers last year. So we did 148,815 home delivered meals through our sponsorship with Meals on Wheels. And then 50,061 meals, congregate meals. Those meals are served at the senior centers, I think 4 or 5 days a week. And then we have our dial-a-ride services through the senior centers also that we sponsor. Last year we did 16,781 trips that were non-medical. If you have anyone that is interested in signing up for these services, you would contact the St. George Senior Center, is your local senior center for both of those. Here is just a little sampling of the offerings at the St. George Senior Center. Five County sponsors the Tai Chi and the Exercise Foundation program, and Maria will talk about those a little bit when we get to the volunteer portion. So one of the big things about Five County is our dollars are earmarked to provide education and information to the public. And so one of the areas that we focus on is caregiver support. So there's a couple different areas of caregiver support that we focus on, but the biggest one is those who are caring for loved ones with dementia. And so we have right now 5 different classes, oh actually 4. The 5th one is already over, but we've got caregiver talking points that has every week there's a different caregiver topic, right? Then we have stress busters, which helps caregivers address stress. We have dealing with dementia, which helps caregivers understand the disease and help care for their care receiver. We have the Empowered Caregiver series that we partner with the Alzheimer's Association with. And I think all of these are up there. If they're not, we'll make sure to get you some if you're interested. But the one that's most exciting that's coming up next month, and I have signups if you're interested, is our Dementia Live. So Dementia Live is a new program that we're spearheading this year. The goal is for caregivers and general public to understand what dementia is and what it looks like for individuals. And so it's kind of an immersive experience. And you get to see what it's like to have dementia. And there's a couple different ways that they, facilitate that. So that, if there's signups over there for that, if anyone is interested in doing that in November. One of the other things we do for caregiver support is we provide crisis intervention training for the St. George Police Department once a year. The training is focused on how to interact with individuals with dementia or any other type of cognitive decline. And then we also have staff members that twice a year teach our early stage memory classes at Memory Matters. So another way that we provide caregiver support to the community is we host our yearly annual senior conference. For the last few years, we've had it in Cedar. The caregiver conference the senior conference addresses a host of different topics that relate to caregiving and aging. So it's there's a huge vendor booth, and it's really cool. So any of these classes that we have up here can be hosted by anyone in the community. So if you have a group or organization that would like to host one of these, that's always something that we are looking for opportunities to put ourselves out there. Okay, so another way that we provide caregiver support is through our support groups and our caregiver support program. The program provides short-term respite. In our support groups, we've got 2 consistent right now. One's in Kanab, and then the other is in St. George at the Catholic Church next to the Senior Center. So those, the one in St. George focuses mostly on dementia education and support, and then the Kanab one is more general. And then we also provide public benefit access to the community for those 65 and older. So what that looks like is 3 different programs. We have our SNP, which is the senior, I think it's Medicare Patrol. Yeah, is that what it is? Okay. Senior Medicare Patrol. So they put out a monthly newsletter that goes to about 3,000, about an email list of 3,000. If you're interested in getting on that email letter, newsletter, that's something that we could facilitate also. It also includes monthly scam alerts, and then we also have our SHIP. My mind just went blank. our SHIP program, and that provides Medicare counseling and consultation for anyone 65 or older. And then lastly, we have our BEC, our Benefit Enrollment Center. So we have someone on staff that can help anyone 65 or older apply for Medicaid, SNAP. List Extra Help is the Medicare drug subsidy, or MSP, which is the Medicare Savings Program, which takes off that Part B subsidy, food box, and then circuit breaker refunds. So that's just broad overview of a lot of programs. So any questions on those ones, I'd be happy to answer after. And I will turn it over to Matt, who is another case manager with Aging, to go over our case manage portion.
Thanks, Bethany. Hello, everybody. My name is Matt. I'm one of the case managers at Five County. I case manage for the Aging Waiver Program, the Alternatives Program, and the Veterans Directed Care Program in the homes of our clients throughout the Five County area. Bethany's great. She's probably going to be your first point of contact at our agency of aging. That's so hard to say. If you call in, she can go over eligibility with you for our programs and do an intake with you and see what your specific needs of care are and what program might be a good fit for you or a loved one. Once an opening for services becomes available, a case manager like myself will reach out to you and make contact with you and get to know you a little bit and set up a time to come out and visit you in your home and complete an assessment and care plan with you. All of our case management facilitated programs are home and community-based services, and they're designed to assist our aging population remain safely in the home setting. They're diversion programs, nursing home diversion programs, so rather than relocating somebody to an assisted living or skilled nursing setting, we want to try and keep people at home if they're able to stay at home safely. So the first one we have up here is the Aging Waiver Program. This one is for age 65 plus that are going to meet nursing home level of care. It's Medicaid funded, and we currently have a wait list that is managed at the state level. The second one we have up here is called TAP, commonly, or the Alternatives Program. This one is generally for age 60 plus. We can provide services for younger than that if they meet level of care and need. And this one is going to be for people needing assistance with activities of daily living. This is state funded. Also, we have a wait list currently for this program. Clients on this program may be on Medicaid, but it is not a requirement. Both of these programs are income-based. Both of these programs help connect you to service providers that are able to coordinate services in the home. And there's a lot of different services that we provide that I would be glad to go over with you guys as well after. Adult companion services, daycare resources, emergency response system, homemaker and light chore service, home delivered meals, and that can be Meals on Wheels that we kind of mentioned. That can be myself as a case manager bringing out Ensure, Glucerna, Boost to our monthly visits. We can assist with getting accessibility and medical equipment in the home, threshold ramps, walkers, toilet risers. We can do non-medical transportation. We can coordinate that. Respite care, personal care. And then there is an option for a personal care attendant on these programs where you could hire a spouse or a loved one to be your caregiver and be paid for that. And then the last program I wanted to mention really quickly is the Veteran Directed Care Program. This is a program that I'm a bit biased towards as I work primarily on this one. It's a great opportunity to assist our veterans and give a little back to them who have given so much for all of us. And I do want to thank Five County and the VA for the opportunity to serve veterans on this program. Financially speaking, it is one of our most beneficial programs to our clients and offers our veterans and their families a lot of flexibility and autonomy in selecting their care team and the services they receive. And this program is a partnership of the Salt Lake City VAMC and Five County. We have 2 case managers on this program. To be eligible for this program, you must be a veteran actively enrolled in VA healthcare and needing caregiving assistance. There's no income component to this program. Simply be VA healthcare enrolled veteran who requires care with 2 or more activities of daily living, such as dressing, toileting, eating, bathing, or have a diagnosed cognitive condition such as Alzheimer's. On this program, the veteran is able to elect a caregiver, and we can assist that veteran and caregiver with paperwork and enrolling with a third-party payee for that caregiver to receive payment for their services. The elected caregivers with this program can be a spouse, family member, community support, friend, neighbor. It can be multiple people or just one. This is a great program for our veterans with a large amount of community support. The veteran will monitor and approve their hours and budget. I personally do the billing oversight for this program, so I'm always available and I'm always able to assist veterans and their care teams with questions or managing their hours and budget. The pay and hours for this program can vary based on level of care. We can assist with equipment too if we have space in the budget, and in the past we've assisted veterans helping them get electric scooters, wheelchairs, home safety equipment, and other items that can take a little burden off the veterans and their families. If anyone wants more information about this program, we've got a flyer over there. My cell phone number's on there, and I can give you my email as well if you'd like. It's a program that we really want to spread across the 5-county area and serve as many veterans as we can, because we have such a massive area in this 5-county area, and we want to make sure that all our veterans are taken care of. We know about the great VA home here in Ivins, and this program is a great kind of complement to that with the wait list here on the VA home. We may be able to enroll you in veteran-directed care in the meantime while you're on the wait list, or maybe if you're coming out of a short-term rehab in the area and returning to the home setting. And that is a lot of information for a very short slide, but we can discuss any of these programs in more detail. It's really hard to kind of summarize these. Some very common questions that I get after talking about veteran-directed care are, how do I know if I'm enrolled in VA healthcare? How can I check my service-connected disability rating? And I'm blessed enough to be able to answer that and say that we have a veteran service officer, and she's speaking next, and that is Janelle.
Good evening. My name is Janelle Esplin, and I am a Veteran Service Officer, or VSO, and I do work under the Area Agency on Aging. A few years ago, we realized that we did have some veterans calling in to the Area Agency on Aging, and they sometimes would ask veteran questions, and we decided to see if we couldn't partner with some veteran agencies, which we've been able to do, Utah Veteran Affairs, and also becoming a VSO means that I can file claims directly with the VA. Things that we will work on with the veteran are health care applications. If a veteran enrolls in health care, it doesn't mean that it replaces their Medicare or their supplement to the Medicare, but VA health care as a program has a lot of services that you will not find in that you will not find in any kind of insurance plan, such as long-term in-home services, personal emergency response buttons, incontinence supplies, equipment, things like that. So it is important for veterans to get enrolled in VA healthcare because it can help their budget stretch farther. Also, VA healthcare is important to be enrolled in if a veteran needs to enter into the VA home here in Ivins. So that's just a little synopsis about VA healthcare. There's also VA benefits, and these would be financial benefits. So this can really make a difference for a veteran or their family members if they qualify for any VA benefits. And these can be pension, which are for wartime low-income veterans, or spouses of low-income spouses of veterans that have passed away. Also, there are VA disability benefits. If a veteran has a disability because of service or because of exposure while they were in the military, such as radiation exposure, Agent Orange exposure, noise exposure, they can apply and see if they are eligible for VA disability benefits. And if they are, that will bring a monthly tax-free check into their home. And that check does not affect their Social Security or any other retirement. So these are really great programs for veterans. It will support families and veterans themselves. And last, I want to talk about VA has a National Cemetery Administration. The first federal cemetery in Utah was just dedicated last month in Cedar City. And that cemetery allows for a veteran or a spouse of a veteran to be buried in a federal cemetery at no cost. So that's really important. And there also are burial reimbursements available when a veteran passes away from the cemetery administration. I will be available to answer any questions if you have them. And just keep in mind that we're really excited to be able to serve veterans. We have a big passion for veterans. As Matt indicated, we really like serving veterans, and so send referrals or come in yourself if that's something that's applicable.
So I'm Maria. I am the RSVP director. RSVP is under AmeriCorps Seniors. It stands for Retired Senior Volunteer Program. For our volunteers, they are strictly volunteer. They do not get paid, and they deliver programs. The first one is our telephone reassurance program. That particular program, the volunteers connect with others in the community. It can be on a weekly basis, it can be on a daily basis. So we have two different programs. One is when there are seniors that need to be called daily. They will receive a phone call every day just to make sure they're okay. There's so many seniors out in the community that live alone, and they just want to make sure somebody knew they woke up and they were safe. And what happens in those phone calls, though, they become good friends. They don't just get checked on. They become actually really good friends. Then we've got the other part of that telephone reassurance program where they get, it's a social call to keep somebody from being lonely and isolated, especially during the COVID era. We had several people that we connected with just to check on them, have a chat. Sometimes those calls are 2 to 3 minutes, and sometimes they're half an hour or so. But it's a connection with another human being. And then we have the classes that we teach. So the classes we teach are Arthritis Foundation Exercise Program, Walk with Ease, Tai Chi, Stepping On, it's a fall prevention. And then we also teach Live Well classes, living well with chronic conditions, chronic pain, and diabetes. Those classes were developed out of Stanford University. The leaders are volunteers. They are trained and certified, and that's something we provide is the training and certification. Then we also provide all of the materials for them to deliver the classes. Last year, in 2024, there were 750 community members that participated in Stepping On, Tai Chi, and AFEP. That's in all 5 counties. And the senior centers host our Tai Chi and AFEP classes. Community host is the Stepping On classes. Those are fall prevention classes. When I say community host, like we've got Sun River that hosts the continuing class, Intermountain Healthcare in Hurricane, Intermountain Healthcare in St. George. We've done it at the several senior centers. So if Ivins wanted to have a class here, we would definitely get a class up and going. We do have certified, trained leaders to teach those. It's a fall prevention program. And one of the things in that class I ask people is, do you know how to walk properly? Okay, you all walked in here, but do you know how to walk properly? Heel toe. And you know, so many people will say at that class is like, that's why I'm tripping, because they're not lifting their feet. They're not lifting, putting the heel down first, then the toes. There's a prevention. So it is a fall prevention. There's a lot more that goes into those classes. That's just a sample. Last year, telephone reassurance, we have 54 volunteers that called 251 seniors. 14 of those volunteers make daily calls, and they make over 40 weekly calls to other people in the community. These are a sampling of some of our flyers that advertise our classes and our volunteers. And we're always looking for volunteers. Our volunteers need to be 55 years and younger, 55 years or older. And like I said, we train and certify. So you just need to contact us. And with that, I have a volunteer in the audience, and I'd like her to come up and just share a little bit about her experience.
Barb, the microphone at the podium looks like it's on too.
Well, then I'll probably have to stand on the other
Okay.
side. Hi, I'm Barb Lewis. I live in Ivins. Up to the mouth, and then everyone can hear me. Thank you. I'm Barb Lewis. I live in Ivins, and I work in both directions, the telephone reassurance program. What I'd like to tell you about is the volunteering side, but to understand what the volunteers are taking care of, I'll talk to you about the fact that I am a recipient. I'm here on my own in beautiful Utah. I came here without any family. Not only do I not have family in the state of Utah, I don't even have family in the time zone, in the mountain time zone. I have an irregular schedule, so even though I'm retired, it would not really be likely that the callers who make the daily calls would find me, and then that triggers a whole thing. They make 3 calls, and then they escalate it, et cetera, et cetera. So I want you to know that the program can flex to your needs. I am a recipient of services because I participate. Actually, I'm the one who makes the contact, but there is someone who knows if I have not made that contact, checks in with me, and would come to my home if need be to find out how come I'm not responding. It's very helpful to me, and my needs are 7 days a week, and my needs are met. My circumstances are different. Probably more people can be found at home and will be available when that day's telephone caller calls. Those callers rotate. They probably do all of the contacts on one day of the week. I, as a volunteer in a slightly different manner. I'm assigned to specific people, and I speak only with those specific people. I have someone that I call once a week. I had someone that I call 3 times a week. And it's an important contact. However, it is not my job to solve an emergency with the person who receives my calls. I do not leave my home. I do not go to them. And nobody in this program in either direction knows the other person's phone number. So volunteers can easily make phone calls from their home. You don't have to say what town you live in or anything like that. There is a wonderful telephone system through Five County that pre-programs in the contacts that I have. And when I call in, they say, push 1 to talk to ABC, push 2 to talk to XYZ. And magic, they answer the phone and I'm speaking with them. It's really great. I'd like to talk about a recent experience that really does speak to why this program is needed. I have a person that I call weekly, and recently, when I made my call, I realized sort of from the tone of voice and everything that something was off, something was not right for this person. This person identified to me some medical issues, and that particular person is blind, and so sometimes needs services of additional people. I excused myself from the phone. I contacted the person in charge of the program, who immediately looked through the file, got my recipient's family member's phone number, got in touch with the family member, and I think it was like within 5 minutes, the person from Five County got back to me and said, I've reached this person's relative, the relative will deal with the needs of this person. It's a really important program. I don't know what I would do without it. I hope to never have to be the one saying, oh, I'm having a problem, I need a doctor, or whatever. But I can tell you that if it became necessary, the person taking care of this in this program would be at my house. And that person knows where the key is, and how to get in the garage and where my key is, and would be helping me if I needed it. So it's a terrific program. We need volunteers. You can make your phone calls anonymously as far as not having to reveal your phone number, and you get to know these people. In my phone call this week, my recipient was saying goodbye to me, and for the first time she said, I love you. So it becomes a close relationship, and it's really, really important. So please consider that you can volunteer as little as 1 day a week. You could be assigned to all of the calls for your day of the week, or you could be assigned to specific people. This is a flexible program to meet the needs of those who have the needs, but they're also careful to provide situations that are good for the volunteers. Thanks.
Thank you, Barb. And also with that, we are also looking for people to call, because we do have quite a few volunteers. So if you know someone in your community, they're lonely or they're alone or could use a check-in, somebody could really use that call, please give us a call. We've got information over on the table, and we'll sign them up. Of course, that's got to be something they want, but we'll go out and talk to them and make sure it's something they want, and we'll get them signed up. So with that, I'm going to turn over to my partner with AmeriCorps Seniors, Emily.
Thanks, Maria. I am Emily Van Len. I am the volunteer coordinator, for 2 special programs, the AmeriCorps Seniors Senior Companions and the Foster Grandparents. The Senior Companions are volunteers that are also age 55 and older. They dedicate 15 hours and more a week to helping other seniors remain independent in their homes. They provide friendship, transportation, light help around the house, and much needed respite for family caregivers. It's all about connection and making sure that no one feels alone and everyone has the support that they need to age. And I will say that the friendship is there, just like they've talked about the other programs. It becomes a friendship. The foster grandparents bring the same heart of service into the schools. They work one-on-one with children who need a little extra attention, helping them read, learn to build with confidence. They are mentors, role models, and consistent sources of encouragement. For the students who really benefit, they benefit from that little bit of extra care, and it also bridges the generation. It's a really special program as well, and I hear stories constantly about our foster grandparents in the grocery store, and all of a sudden a little child goes, "Grandma, Grandma," and the parents go, "Who are you saying that to?" But the connection is there and made really special. The volunteers with these 2 programs, they do receive a small tax-free stipend. They get meals and mileage reimbursement, and they have paid training. But most importantly, they do receive the joy that comes from just giving back. This year, we actually had an Ivins resident retire as a senior companion after 20 plus years of being a senior companion. He served a lot of Ivins residents and St. George residents with a lot of love and kindness. In our programs, we like to say that we rise by lifting others, and these programs truly do that, strengthening both our oldest and our youngest generations at the same time. So if you know anyone who's age 55 and older and would like to make a difference, whether they're visiting with the seniors or working in the local schools, please let them contact us. And thank you for supporting our programs and keeping our communities connected.
Hi, I'm Valine Burke. I am a long-term care ombudsman in Washington County. We also have an ombudsman that covers the other 4 counties. Her name is Susan Swap. And then we are ombudsman. But very few people know that word. It's a Swedish word that us Americans have decided to use to identify resident advocates. So I help serve residents who live in long-term care facilities. That's assisted livings, nursing homes, and skilled nursing facilities, like where you go for rehabilitation after an injury. And our purpose is to provide free confidential service to become your advocate, separate from the facility. Some of these facilities will have resident advocates, but they are hired by the facility or the corporation, where we can come in as a third party and we are a literal extension of that resident's voice. Because you have rights even when you're in a long-term care facility. And everything is private. We have conversations with residents if they are feeling like their voice is not heard. We can help advocate for them with the facility so that they can get the help that they need. And just looking at my thing to see if I missed anything else. Mostly we focus on rights, and we can also help educate facilities to follow state and federal regulations, because sometimes they don't do that, and we can help them too. So we kind of act as a liaison between the residents and the facility. But our main job is to speak up for that resident. So, and anyone can call and make a complaint or have a concern with us. You don't have to be the resident, you don't have to be a family member, you can just be visiting and say, oh, that doesn't look right. And you can call us and then we'll go investigate. And we only get involved if that resident says, yes, I want your help. If they don't, then they're happy, then we're happy. So that's pretty much it.
Hi, I'm Myron Lee. My program, I'm going to talk to you about 2 different programs. What have I got to do? Testing. Myron Lee. I've got 2 programs that I wanted to talk to you about today, and the first one is the Dixie Metropolitan Planning Organization, and we're looking. Our program is looking at the transportation facilities, primarily roads, transit, and active transportation facilities in the metropolitan area around St. George, including Ivins, Santa Clara, all the way over to Laburke and Virgin. We put out 2 products that are web-based. The first one is the Unified Transportation Program. This is in partnership with the other MPOs throughout the state of Utah. And the Unified Transportation Plan is very long and detailed. And if the computers will cooperate with me, we'll just dive into some of the planning projects that we are involved in. Oh dear. Just go in here. Can I just go in here? There we go. In our little corner of Utah right here. So this is our active transportation plan. Ivins is a very good participant in that active transportation program. The dotted lines are planned trails. The solid lines are existing trails that need improvement. And I've got to think on my feet here for a minute. It's been a minute since I went through this. There we go. Let me jump to this other side. It's a lot easier to run through. There's not a link there. There we go. This is a duplicate map that's just in a little bit different format. I'm much more familiar with this one. So in the Ivins area, this is our regional transportation plan. These are roads that are needed in our region. Red is for phase 1 to be built in the next 10 years. Blue is for phase 2 and purple is phase 3 in those 10-year increments. The primary project that's facing Ivins today is a connection from Old Highway 91 that would go around and tie into Gap Canyon Parkway that would eventually take people around to Dixie Drive. We're trying to get that project off the ground and running. That project today is where the Southern Parkway was in 2000. The Southern Parkway is finally got up and running by 2020. So we're actually planning projects out in the long range. So again, the active transportation plan has a lot more in it, and we're looking for public input on those plans.
Byron, not everyone might know what active transportation plan means.
Active transportation plan. That's if you're moving around the community, not in a car. So bicycles, wheelchairs, scooters, walking, jogging. These projects are all trail projects or bike lane, things like that. Thank you, Darren, for hitting me there. So in our planning of those transportation facilities, we have our main public involvement activity every year is the Dixie Transportation Expo that is held at the Dixie Center in February. We'd like to invite everybody to come out to that, and we'll just ask you to watch your city newsletters for that advertisement in February. We work with the elected officials here in Ivins. We're working with Mayor Hart is on our executive board, and Chuck Gillette and Tom Jorgensen are on our advisory committee. These people are very valuable. They help us understand the long-range plans here in Ivins, and we've been working with them over the last couple of months to try to write an update to the Ivins City Master Transportation Plan. We're actually contributing $100,000 to that effort, and we're hoping that can be updated by the end of the year. The other program that I'm working with is the Mobility Management Program at the Five County AOG, and that's a program that reaches out to the full 5-county region. Name the counties for me. Iron, Washington, Beaver, Kane, Garfield. Is that 5? Okay. Oh, it's right there in front of me. Sorry, guys. The Mobility Management Program advocates for instigating projects that will increase the access of individuals with limited mobility. And those target audiences are seniors, peoples with disability, and low income. We're taking we're taking people through the program and trying to connect them with buses, transit, helping them understand how they can continue to be mobile. A lot of what my coworker Scott Bies does is work with transit providers such as the Senior Center, SunTran, CATS up in Iron County, and other providers of transportation to make sure that he's connecting people with trips that they can make. He'll actually go out into the communities when somebody needs help understanding the transit system, and he'll get on the bus with them and just educate them on how to access that ride, how to get from place to place. He'll jump on senior buses and the like to get people to their to the things that they need, doctor appointments, grocery stores, etc. Again, the goal of the program, if this works. All right, there we go. The goal of the program is to assure that strategies which aim to increase access and mobility are actually implemented. We start out working with elected officials, transportation providers, employers, and businesses that have rideshare things. We work with our target audience, seniors, people with disabilities, low-income services, to get to that goal of training people how to get
to look for in a child care program. So we want to help parents with that. We also know who to call for early intervention services or for mental health resources. We want to work with other County agencies if somebody needs housing, or now I know transportation. Yay! Here's our little QR code that takes you to the child care website where parents can search for care. We also are a resource for child care providers. You have 2 licensed care providers in Ivins. One is a very dedicated family provider that's been doing care for upwards of 15, 20 years in her home. Your other licensed provider is Tuacahn, and I believe they do birth through, yeah, and they are awesome. For providers, for potential providers, we provide resources for starting up a license program. We know where to find grants and money to help you start up. We have checklists for what the licensing steps are and other things you need to do. We provide money for to reimburse for things like fingerprinting and background checks, and if you need a fence to go around your yard, other things that licensing requires. We also do a lot of the provider's professional development. So we do a lot of their training or point them to training. We have staff, we have 1, 2, 3, 4 early childhood specialists. They do observations for the quality system. Utah has adopted a quality system for our child care providers because we don't want kids sitting in front of a TV at somebody's house all day. So they do observations, they score based on those observations, and your child care programs will get a rating. We have everywhere from building quality to high quality. We also do, and they do coaching also in the centers, right? In family programs or in the centers. They go out and coach the providers and teach teachers how to interact with the kids, what materials they might need, all of that stuff. We also do an early childhood conference. We have between 250 to 300 early childhood professionals, and we do keynotes and sessions and try to be inspiring and teach them a little bit. And then I have a little QR code for parenting resources. Our website is childcarehelp.org, and we have sections on our website for parents and providers. So, I don't know how to go back. 23, 22. That is all, that is all I have. You want to tell me? I can switch it either way.
Hi, everyone. Good evening. I'm Amanda. Thank you for giving us this opportunity to talk about strengthening our community, really one person at a time. And this is Nikki. In our department, right now we're having a little bit of a transition where the Community Action Partnership is also combining with the weatherization Community support services, but we are undergoing that right now.
But for now, all the slides are going to say CAP. So
Yes, so CAP is what we were, but community support services is what we will be. But the services are the same. So our mission in our department is to help move people from crisis to stability to self-sufficiency. So every day we meet residents that are really facing some heartbreaking, sometimes challenges, and we help them through that. So these services that we do, the court-ordered community service that gives individuals structured, meaningful way to give back and reconnect to their purpose. The employment supports, that's where we help people obtain vital records, bus passes, and just remove barriers so they can work. The emergency food and shelter support. So this is where we help people with like I guess that speaks for itself. Go ahead.
we sub-grant to some of the pantries and shelters throughout the 5-county area to help them with not just providing food to families in need and households in need.
Yeah, there we go. But also helping them supplement their cost for shelter bed nights and meals provided within the shelter when people are staying at homeless shelters, DV crisis centers.
Thanks. And then we have the rapid rehousing and homeless case management, the temporary assistance for needy families. That's kind of short-term support. We'll go more into that. And then we have the Circles program. The Circles program is actually the one that I'm biased to because that's the one that I work into. So each of those programs that I just talked about they're kind of bridges to each other, and they're more than just a service. They're bridging the individuals we work with towards independence, toward dignity, and more community strength. So why? I think with every program in our community, it's always good to ask that question, why do we have this? What is the need for it? And in our department, when we work together, we don't just meet the needs, but we also change lives, we strengthen neighborhoods, we create opportunities for everyone to thrive. So if we look at this graph, we see that, and this is according to map.utah.healthyplacesindex.org, we see that more than a quarter of our residents live below 200% of the federal poverty level. So you see that the average monthly wage in Washington County is $3,860. The Utah average monthly wage is $5,242, but the living wage is $8,083. So these programs in our department help families, they help them stay housed during crisis and build skills for a long-term self-sufficiency. So just to dive a little deeper into these, the court-ordered community service, this is Washington County residents who they may not be able, sorry that's spelled wrong, may not be able to pay for court fines. And there is a processing fee. How much do we charge per page on that?
It's $1 per hour that they're required to serve.
So $1 per hour, but then there's a max, so the max they will pay is $50. And we provide a list of nonprofits they can work with, and we submit the paperwork to the court at the completion of their service. Then we have the employment supports. That's for people who are below 125% of federal poverty guidelines, and we help people searching for a job that need qualifying documents for employment. That number did change, yes. It is now below 200%. We've had
They should be making more money still.
yeah, so 200% federal poverty guidelines. The documents include birth certificates, driver's license, and then we'll also help with transportation to a job by providing a bus pass. So this next slide. The emergency food and shelter support. So as Nikki was talking about, this is where we coordinate funding, reporting, and monitoring for 12 food pantries. So 2 homeless shelters and 2 domestic violence shelters in Southwest Utah. We also, the Temporary Assistance for Needy Families, which we call TANF lovingly. That's assistance program for families with children to secure housing and prevent homelessness. And to qualify, they must have a one-time emergency and be earning less than, there we go, 200% of the federal poverty guideline. And then the rapid housing assistance that's where we move homeless adults and families from shelters into housing as fast as possible. And that provides intensive case management to stabilize and work towards self-sufficiency. Any of these 3 programs, if any of you have questions about, ask Nikki about afterward. So the Circles program, this is the final one I'll talk about. So the mission for the Circles program is to build community to end poverty through intentional friendships, personal transformation, and systemic change. And it's led by the people closest to the challenge. And I think that that's probably the most important part of the Circles program is the leaders in our program are those who are facing these challenges every day. And the why is that it helps families increase social capital by providing families with middle, high-income volunteers. So it's an intentional friendship. It's an intentional partnership that we have. I think a lot of us get stuck in our social circles, which is why it's called Circles. We tend to gravitate towards those who are like us, who, we share so many common interests. So in this program, we intentionally take people and put them together, and it's such a good program. We have so many people who are getting out of those poverty cycles just by seeing, there's a different way to do this. So that's how we do that. We also focus on improving their credit score, focus on helping them contribute to a savings account, increase employment earnings and hours, and then this is the place where they share their story, they feel heard, and we help them improve communication, time management, and become better role models for their kids. I think hope is something that we don't talk enough about in our society right now, and to set goals with this group of people really instills hope in them and to make progress, to achieve those results that they need, and to move from poverty to financial stability. So I just wanted to end by sharing, we do meet on Wednesday nights over at the Grace Episcopal Church. So if you're interested in coming to a meeting, you'll leave with you'll leave with a full stomach and also a full heart, because you'll see the difference that this is making. I just wanted to share 2 of our leaders said that Circles, so this is Kat, she says, Circles has helped me realize the value of my individuality, that I have a voice worth being heard, and I'm learning how to advocate. I love seeing the strengths of others and learning new ways to look at and accomplish things. And then Adby says, Circles has helped me tremendously by giving me the tools, knowledge, and confidence to move forward. Before joining, I felt stuck and overwhelmed by my situation, unsure of my options or how to take the next step. Through the program, I am learning how to navigate the process, find resources, and make informed decisions. Most importantly, I feel supported every step of the way. So I just invite you to attend or go over and find Catherine Moster. She's our coordinator. Find her card and see how you can get involved.
Or become an ally. Volunteer to become an ally. That's what we suckered Myron into doing. And he loves it, right? Yeah, well.
Myron's one of our allies, and we really appreciate him.
And it's great. He's not listening. That's all right. Do you have anything else to talk about?
Hello, my name is Minerva Marcus. I'm the program coordinator for the HEAT program. So the Home Energy Assistance Target Program, also known as HEAT, is a federally funded energy assistance program. The goal of the program is to assist eligible individuals and families meet the higher costs of energy during the winter and the summer months. The program typically runs from October 1st through September 30th. The program may provide a one-time assistance to low-income residents per program year. Target groups for the program include families with children age 5 and younger, the elderly, and residents with a disability, but the program is also open to households outside those target groups as well. To qualify for the heat assistance, households' total income must be at or below 100% of the federal poverty level. In addition, the household must be responsible for paying home energy costs and include at least one adult who is 18 years of age or older or emancipated. Eligibility requires that the household contain at least one U.S. citizen or qualified non-citizen. Currently, we're not accepting applications due to the federal shutdown, but you can visit our website or call our offices for updates on dates when funding will be released. Hopefully it's here soon so that we can start resuming those services.
I'll talk to it. So the sister program, which is funded through the same mechanism.
Grab mic, please.
So the sister program to HEAT is our weatherization assistance program. We have a team of weatherization experts, and if you qualify for their services, qualification, you have to be HEAT eligible. You can get new furnace, you can get insulation, you can get new windows. We even have crisis money for critical things like refrigerators, things of that nature. So we run that program out of our Cedar City office, but we cover all 5 counties. So.
Does anyone have any questions for any of us?
I do. Hey, Matt, you used a term, hang on a minute, I gotta find it. There's an income component. Where did Matt go? There you are. Hi. And I know several of you, when you're talking about your programs, there is an income component of it. Are all of the programs for lower income or below poverty level, or is there a variety in there?
There's a variety in there.
Okay.
For case management wise, a lot of ours are going to cater to lower income eligibility unless it's a veteran program.
Okay, and that's what I was going to ask specifically, because we have a lot of veterans here in Ivins,
Yeah.
and they're facing a lot of challenges these days economically with everything going on. So are the programs and services for the veterans, do those have to fall below the poverty level typically? No?
No, not for my program and not for most of the general stuff.
Okay, that's awesome to know. And I also just wanted to let you know from a veteran side, we do Wreaths Across America in December every year. I think most of the cemeteries around here do it, but you're welcome to come and participate in ours in December, where we place a wreath on, it's a national program, Wreaths Across America. We place a wreath on every veteran's grave site to thank them for their service. So anyway, thank you.
Barb Lewis experienced participant speaking to you again. Stepping On program was very important to me to help me limit situations which could lead to falls in my home. I want to share maybe one of the more unique things that I did. I use oxygen at night, and I also need to sleep in a cool room, so the oxygen concentrator is in the next bedroom over, and I just have the lung cord on it and everything. And it would be on the floor crossing the threshold of the one bedroom, and I would think that I wouldn't trip on it because I know it's there, but I'm the person who also learned in Stepping On that a change in grade of as little as 1 millimeter can trip you, and I'm one of those people because I do not lift. I may or may not walk heel to toe, but I don't lift my foot very high. But what I ended up doing with the cannula hose was I got some clips, plastic clips. Probably people would use them for holiday lights. I don't use holiday lights, but I put them around the door frame, so now the cord goes from the concentrator up and then over to the bedroom where I actually use it. So that was really important. I've also taken a one-day program, I forget the name of it, but it's conversations about dementia, living, not that I would be living with dementia, I might be a caregiver, or I must just feel like I need to know. And one of the interesting things that I learned in that program that I wouldn't have otherwise known is that it might take up to a full minute for a person with dementia to comprehend what you just asked of them. So for example, you might say, put your shoes on now, we're leaving for the doctor's office in 10 minutes. And you might come by later and the shoes are not on. So one of the things that the trainers did, they took out their watch and they set the alarm for 1 minute. And they said, okay, put your shoes on, we're going to the doctor in 10 minutes. And then everyone in the classroom had to be silent to feel that full effect of 60 seconds. And basically, after 15 seconds, everybody said, look, is that 60 yet? No, it's only 35 seconds. And so you learn a lot of skills by attending these programs. And I haven't paid for any of the classes because they're grant supported. But the most important thing is, if you're going to sign up and take one of these classes, because they are grant supported, you need to commit to coming to, if you can, every session, maybe only missing one. It doesn't work for people to try the program out and just come to the first class or the second class, because then you'll hear from Maria, I'm sorry we don't have enough to keep going, we have to cancel the class. So these are wonderful classes. Please share the information about them, but please let people know it's a commitment. It's for the benefit of all.
I've got a question since I have the mic. Legal assistance for elderly that cannot afford legal assistance. Does anybody have any sense of how that works, or are you able to talk about that today? But just curious, those folks, legal things are becoming more prevalent and more difficult for people to afford or even hire. I'm just curious, do you have any thoughts about that?
I can tell you a little bit about it too after. Go ahead then. Yeah, well, there's two. Utah Legal Services will help with application processes for like Medicaid, Medicare, that kind of thing. But if you want specifically free legal services, Disability Law Center, and they are designed for people who have, they're for our vulnerable populations with disabilities and older adults. I believe, I want to say 60 and older or 65 plus. But they also have like a Utah legal, what do they call it? It's like the night bar or something like that. It's up north, but it's a free, I think it's pro bono, and I know it's up there. But if you're over there, I think it's every Tuesday night, they like some lawyers get together and they consult with people free to help that way. But Disability Law is the one you'll want to contact. If you need help with applications and that kind of thing, then Utah Legal Services. And they are free numbers. You just do a Google, or I can give you the number if you call me.
We also have an office out in the Hurricane Valley area. I don't know if you guys are familiar with the new food pantry that's out there, but Crystal from Utah Legal Services goes out there once a month and sets up camp in our office space out there to meet with any clients that need assistance, free legal advice. So you just kind of have to watch our website to know when she's available, because then we post it on there.
And Utah Veteran Affairs has a clinic once a month down here for legal advice for veterans.
I have a question. There we go. Thanks. I am really impressed with the amount of resources that you all offer and how motivated and dedicated with these various services that you provide. I think it's wonderful. I do wonder if, and I hope I don't offend anybody by saying this, but about 6 years ago, I didn't live here, but my parents did. And my mother was diagnosed with dementia. And when I decided it was time for me to join them, I did not get any support at all from her primary care physician here. I was looking for services that my father and I could go to research memory care facilities. I ended up calling the Alzheimer's Association in Chicago, and fortunately they have a 24/7 hotline. But I can't tell you how frustrating it was. And I do hope that this is also, all this information that you have shared with us is provided to our local medical community. Because I have talked with other friends who friends that are showing signs of dementia, and they do not know where to go. I will say Memory Matters is another fabulous place here for people to get familiar with.
I used to be in that world. So there is a company, and I'm not plugging them, it's the only one I know of, I think there's two, that is a free resource to families when your relative, person you love or whatever can't be at home anymore and you need to look for a facility, and it's called A Place for Mom. And there's also a company called care.com. They are both free resources to anyone. It costs you nothing. You may use them, you may not use them, but they will talk with you and they will recommend places for you to go look at. They're not going to tell you where, live this one, that. They'll give you reviews, they'll give you information, and then it's up to you. But it is a free resource for you.
I was just gonna say, I feel like that's a struggle that most or all of us have, is getting the public to know that we have these services available. We try to go to community events and talk to the public in as many ways as we can, like this, but it is hard to let everybody know that we're here for you.
And I'm going to talk what you just said. We have.
I need you on the mic, please.
So, in our aging department with Five County, we do have the caregiver resources. So if you know of anybody in that situation, have them call our main office and ask for Bethany. She will direct you to the services that we have available. Like the classes, the dementia dialogues, the caregiver resources, the support groups. They're beneficial and they're free. Again, they're services that we provide. And our people that are educating you are trained. They're trained to give those services. And then we also have outside resources in the community to share. So contact us, please.
Can we get this information on this Five County Association of Governments? Is that an online thing that we can go and access what you have shared with us?
We have a lot of brochures we have over here. They're for you to take. Please take whatever you need and whatever you want. Share it with your community. And that's the whole purpose tonight, is to get the community so they know what we have to offer. How many learned something new here?
So there's no over.
Yes, there is.
Yes, there is.
So
we've got one right over here.
FiveCounty.utah.gov.
This brochure right here is. This brochure right here is an overview of Five County, and it does have our website on the back side, and it's also got our number of our office. Please, you're welcome to take any of the materials you'd like.
you probably already have this under your auspices. I don't know. But you know how you hear on the radio all the time? If you don't know who you want to help, just go to justserve.org and you can go there and there's a whole list. Is there a whole list of all this stuff so you can just go to one place and find it? And let's advertise it on the radio. Justaskforhelp.com or something. I don't know.
So with Darren joining us recently, as he said, we are getting a consolidated website where you're going to be able to go to that website and see everything that we have to offer. We're getting better.
Well, not just you guys, but all of us.
But everybody, right.
That's doing everything that's working in the departments.
We need to network together.
One website.
It is a moving target. Everything changes too fast.
Just to answer that question, I have friends up in Ogden Weber who just spent 2 years creating a list of resources for their community. It took them 2 years and it's a moving target, but it can be done, but it takes buy-in, it takes people dedicated to do it, and it is a moving target. They did it specifically for single moms, and when they started with that said, no, we need to do it for everything. So it is something we can do in this area if somebody wants to head that up. But I know especially for government programs, it's a moving target, so.
In the state of Utah.
While she's fumbling with the microphone, I can tell you that we do have a 211 website in the state. It's run by United Way, and it has all of the resources on it. If you need help with food, housing, clothing, things like that, you can go. That's the catch-all thing that you were talking about, and we keep it pretty regularly updated. Like, we have to update it with our services when we get new grants and new funding. So each organization would have to update their own section to it, but it's usually pretty accurate.
What's that called again?
It's 211.org, right? You can also call it too. There's an app, there's the website, and there's a phone number, the 211 number.
Sharon, you might want to talk about Ivins Inspired, but I will let you know that there is, I guess you would call it a data bank, where people in Ivins have been registering either because they're already volunteering or they're looking for new opportunities. So if you go to the ivinsinspired.com website, there is an opportunity to click a link to register your interest in volunteering, and you may indicate, I want to work with animals, I want to work with the environment, or whatever. But when you get on their mailing list, you then get emails about opportunities that you had not known about before. Last spring, there was the opportunity to learn about the Sharing Place, which is an organization that supports children who are grieving the death of people, not the death of pets. I had to ask that question. I've been trained, and I'm starting in November. And I learned about that because Ivins Inspired learned about it and shared that opportunity with the mailing list.
Thank you, Barb. You're our best advertisement.
I was invited for a reason.
Are there any other questions that we can address? Well, I'm going to speak for all of us at Five County. Well, actually, I should let Darren close us out.
Go ahead.
You'll speak for everybody.
I just want to thank you for giving us the opportunity, honestly. And when I say you are probably the most educated people in Washington County now about what we offer at Five County Association of Governments. And we probably created as many questions as we answered, but call us, go to our website. We have a great staff, and they'll get you to the right place. And once again, thank you for the opportunity. Appreciate it.
Thank you.